Good afternoon. It's good to have you with us at this hour. I'm Daniel Che here to update you on the COVID-19 situation here in the nation in South Korea. We'll be bringing you the briefing from the health authorities shortly, complete with the latest figures and updates. And before we go to the briefing room when they're about to start, we would like to fill you in on a few details that's been developing here in South Korea regarding the COVID-19 situation. It looks like they are ready for the briefing, so let's go straight to the area right now.
Let us now begin our regular briefing for July 11th, Saturday, on the COVID-19 response here in South Korea. As of today midnight, we have 20 new local infections, and the confirmed accumulated number of confirmed cases now stands at 13,373, and a total of 941 people are in quarantine, with 79 more recoveries yesterday. And the imported cases, we have 15 more, and the death toll remains unchanged from yesterday. Here are some major updates on domestic infections related to the Lotte Midopa Gwanghwamun building in Jongno-gu, Seoul City. We have one more additional case, and we have a total of 7 cases. And we also have one more case regarding the door-to-door sales group in the Seoul metropolitan area. And in relation to the cluster infection in the Gyeonggi-do Uljangbu City, we also have one additional case, increasing the number of total to 30. And in Anyang City, regarding the Lord Glory Church, we have 2 additional cases, and the total now stands at 26 for that specific church. Next, in Daejeon City at the Seogu 더 Joon Hospital, we have 1 additional case. We have 18 cases in total to date. And moving to Gwangju City, regarding the door-to-door sales group, we have 6 more cases, and a total of 127 cases have been confirmed to date. And also staying in Gwangju City, we have a badminton club in the Bukgu district, and we had the first index case being confirmed on the July 8th, and we have a total of 4 confirmed cases to date. Next, we have some updates on the imported cases. Yesterday, we had 15 new imported cases, and we have 8 being detected at the airport quarantine, and the rest of the 7 were detected in their communities while they were on the self-quarantine. And 5 of them were from America, 10 from Asia excluding China, 4 were from the Philippines, 2 from Kazakhstan, and 2 from Uzbekistan. And in relation to the quarantine measures at the point of entry, we have also conducted on-site on-board quarantine for about 33 boats that embarked in South Korea yesterday. And in relation to the plasma treatment, we also have a total of 375 people who extended their intentions to donate their blood, and a total of 171 people have actually donated their blood plasma samples. And we will believe that we will be starting the development of these treatments starting from next week, and we will also begin the clinical trials very soon. And aside from these clinical studies, we have 500 people in the Daegu City who have agreed to donate their blood plasma samples. And therefore, we will dispatch a special bus to the region, and also they will be utilized in our blood plasma treatment R&D. So in this end, we would like to thank all of the people who donated their blood plasma samples, and we ask for your continued support going forward. And last time, the KCDC also mentioned that we have carried out and the disclosure and sharing of about 5,500 clinical data of the confirmed recovered patients, and we will have these information dispatched to about 11 research centers nationwide. And all of these clinical data will be helpful in identifying and analyzing the issues and characteristics of COVID-19 and helping the development of a cure for those with chronic and also very severe symptoms, and they will be contributed to the development of further analysis in the future. And next are some updates on remdesivir, which has been imported on a special procedure. And as of yesterday, we have finished administering the drug to a total of 42 patients here in the country. Last but not least, marking the weekend, we would like to make special announcement for the religious circles. We have highlighted multiple times that small religious group meetings could be the venue for the spread of the coronavirus. So we ask you to refrain and cancel, postpone your gatherings. And if you go to the on-site service, please reduce the number of participants and always wear face masks and keep a 2-meter distance at all times. And even when you sing together, instead of singing and chanting, please do not sing and just play the musical instruments rather. And also when you talk on the phone, please wear your face mask or talk outdoors. And in regards to COVID-19, we have a few more announcements. On a daily basis, you are being updated on the statistics of the outbreak, and you need to also take into account separately the new local infections and the new imported cases. Of course, new imported cases, as for them, they also will be determined and will be greatly dependent on the number of foreign outbreak, and the central government is also improving its quarantine measures to tackle the increased number of imported cases. And however, all of these foreign entrants are on self-quarantine, which is mandatory for 2 weeks. Therefore, we believe that these imported cases has a very lower risk of spreading the virus within the community. So please focus on the local infections. As for today, we have 20 new local infections. So please focus on this number and please participate with us in curbing the spread of the virus going further. As of now, globally, the COVID-19 is also spreading at a very fast pace, and the countries are also facing serious conditions. In many countries are also easing their lockdown, and we are seeing a sporadic surge in the number of confirmed patients. And as the WHO has warned, there are also countries and regions with no outbreak right now. However, they are not free of COVID-19 because this virus can spread anytime, anywhere at 3C environment, which is closed, crowded, and close contact. In other words, the only effective measure against the COVID-19 spread is wearing your face mask and complying strictly with quarantine measures. So these are the only effective measures for prohibition right now. And as for South Korea, compared to any other countries, we have shown a great level of participation by the public in the social distancing measures, as well as wearing a face mask. And this was also shown in the analysis of the antibodies. Of course, this is just a neutralizing antibody. However, we have shown that these were the results of high participation of the public in social distancing. And lately, we have seen a sporadic surge in the number of confirmed cases in the metropolitan area, as well as Chungcheong provinces. However, we have been limiting the number of the spread at many places. And these were also thanks to not only the public support, but also the efforts put forth by the local government and the central government. And we also understand that every one of you hopes to return to pre-COVID-19 days. However, even at this moment, if we stay complacent and if we do not stay vigilant and go away from refraining from the closed, crowded, and close contact environment, we will see another surge of the COVID-19. So this is a big comparison, and it can be compared with the advent of the internet and also the advent of the smartphones. So please note that the pre-COVID-19 and the post-COVID-19 era is very different, and please continue to take efforts in maintaining quarantine protocols. Thank you very much.
And that's all from us at this hour. As always, thank you for watching.